If your shoes don't fit by 5 p.m. and your ankles look like balloons every night, stay with me because food number 3 will shock you. Swelling in your lower body, what we doctors call edema, can be more than just an annoyance. It can truly interfere with your life. For those of us over 60, the signs are often clear and frustrating. The most obvious thing you notice is that visible puffiness. You wake up fine, but by lunchtime, your feet and ankles are expanding, and by the evening, they look significantly bigger than when you started your day. This worsening as the day goes on is a classic sign. It's just gravity at work, pulling excess fluid down. You might find it hard to get your usual socks on or off, and when you finally do, those deep red indentations they leave behind tell you exactly how much fluid your body is holding on to. There's also a noticeable change in your skin. If you gently press your thumb into that swollen area for a few seconds and then lift it, you might see a temporary dent or pit remain. That's called pitting edema, and it's the body confirming that you have extra fluid trapped in the tissues. The skin itself can look stretched, sometimes shiny, or even feel a bit tighter than normal. This internal pressure causes that dull ache or that heavy, tired feeling in your legs. You start to think of your legs as slugging or weighing you down. This heaviness makes moving more difficult. Simple actions like bending your ankle become stiffer, making your walking feel awkward. Climbing stairs, or even just standing at the kitchen counter for a while becomes a chore. For some, the swelling creeps up into the calves, making the entire lower leg feel uniformly full. This is often the point where it begins to disturb sleep, as finding a comfortable position in bed seems impossible. Even minor symptoms, like the sense of tingling or difficulty wiggling your toes, are your body's quiet ways of signaling that the natural balance of fluids is being disrupted. Understanding these daily signals is the first and most crucial step toward feeling better. Stick with me because next we'll uncover the surprisingly simple reasons why this happens and how just standing or sitting differently can make a big difference. Knowing the root cause of the swelling is truly empowering. This fluid buildup in seniors often comes down to a few key biological systems that, quite naturally, aren't as quick or efficient as they once were. Your body's plumbing, the blood and lymphatic systems, has a tough job getting fluid out of your legs because it's fighting gravity. Inside the veins of your legs are tiny, delicate, one-way valves. Their sole purpose is to keep blood from dropping back down. As the years pass, these valves can become a bit worn or damaged, a condition we call venous insufficiency. When the valves can't shut completely, blood and fluid begin to pool in the lower legs and feet. This is the single most frequent cause of ankle swelling. Similarly, your lymphatic system, which is like the body's garbage disposal, collects tissue fluid and waste. If those vessels get sluggish or blocked, the fluid has nowhere to go but to sit in your legs, leading to swelling. Another major player is the salt you eat. When you consume too much sodium, your body responds by holding on to water fiercely, trying to dilute the salt concentration. If your diet is heavy on processed snacks or easy takeout meals, you are inadvertently instructing your body to retain that extra fluid. And where does gravity pull it? Straight to your feet. It's also interesting that not drinking enough plain water can make swelling worse. Your body misinterprets this mild dehydration and goes into a preservation mode, hoarding every bit of water it can, which ironically adds to the fluid retention you feel. Finally, we must consider the two vital organs that manage all this fluid, your heart and your kidneys. If your heart is not pumping with full strength, a condition often referred to as congestive heart failure, it creates a back pressure in the veins. This pressure forces fluid to leak out of the blood vessels and into the surrounding tissues, especially in your lower legs. Your kidneys, the body's filters, remove excess salt and water to produce urine. If their function is diminished, they simply can't remove enough sodium and water, resulting in noticeable fluid buildup. And a final note on medications. Some common prescriptions for blood pressure or pain can actually cause or worsen swelling as a side effect. If you suspect this is happening, please talk to your doctor right away. Never stop taking a prescribed medicine without their guidance. We've covered the why. Next, we dive into the delicious, natural how with 10 powerful foods. Remember, food number 3 is the most surprising and one of the most effective. The good news is that the right nutrition can act like a natural drainage system, helping your body flush out excess sodium and boost circulation. We are going to focus on foods rich in potassium, magnesium, and those that are naturally hydrating. First, watermelon. It is over 90% water, making it a fantastic, gentle diuretic. It encourages your kidneys to produce more urine, effectively flushing out the retained sodium and fluid. Plus, it has antioxidants that are great for your circulation. Eat it chilled as a snack. Second, bananas. These are absolutely loaded with potassium. Potassium is a crucial mineral that directly fights the action of sodium in your body, helping to restore fluid balance and lower the blood pressure that contributes to swelling. They are the perfect addition to your breakfast. Third, cucumbers. This is the food that may shock you. Cucumbers have an extremely high water content, but they also contain special compounds like sulfur and silicon. These elements actively assist your kidneys in flushing out not only excess fluid, but also waste products like uric acid. Because they are so low in calories and sodium, they are one of the most efficient natural diuretics you can eat. Try adding thick slices to your glass of drinking water. It's incredibly refreshing. Fourth, ginger. Swelling often comes with hidden inflammation, and ginger is a natural anti-inflammatory hero. Its active compounds can reduce this systemic inflammation, which directly eases the pressure and discomfort in your swollen legs. It's also a known stimulant for circulation. Sip on fresh ginger tea or add it to a light meal. Fifth, beets. Beets are rich in nitrates, which your body transforms into something called nitric oxide. Nitric oxide is wonderful because it makes your blood vessels relax and widen, like opening a highway ramp. This drastically improves blood flow and reduces the fluid backup pressure. You can roast them or just drink a small glass of beet juice. Sixth, leafy greens like spinach and kale. These greens are a treasure trove of magnesium. Magnesium is involved in hundreds of bodily functions, including regulating blood pressure and improving the flexibility of the blood vessel walls, which keeps the circulation flowing smoothly. A handful in a salad or lightly sautéed works wonders. Seventh, citrus fruits such as oranges and grapefruit. They are packed with vitamin C, which is essential for building strong, flexible blood vessels. When your vessels are sturdy, they are much less likely to leak fluid into the surrounding tissues. Eighth, asparagus. This vegetable is one of the oldest known natural diuretics. It contains an amino acid called asparagine, which gives your kidney function a good, solid boost, helping to excrete excess sodium and water. A quick steam or light roast is all it needs. Ninth, dark chocolate that's at least 70% cocoa. The special compounds in dark chocolate encourage the production of nitric oxide, much like beets. This improves the elasticity and flow of your blood, preventing pooling in your lower extremities. A small, simple square a few times a week is plenty. 10th, salmon and mackerel. These oily fish are packed with omega-3 fatty acids. Omega-3s are incredibly powerful for calming inflammation throughout the body, reducing the swelling component of edema and supporting your overall heart and circulatory health. Aim for 2 servings a week. These foods are your body's allies. But diet isn't the only tool. In just a moment, I will share 3 simple senior safe habits that you can start tonight to see a difference by tomorrow morning. Managing swelling effectively means incorporating small, safe changes into your daily routine that actively help your circulatory system. The first and perhaps most vital habit is to elevate your legs. This is simply using gravity as your friend. When you raise your legs above the level of your heart, you create a downhill path for that pooled fluid to drain back toward your kidneys and heart for processing. The action is simple. Lie down on a couch or on your bed and use 3 pillows to prop up your calves and feet, or gently rest your legs up against a wall. Do this for 15 to 20 minutes, 3 or 4 times a day, especially at the end of the afternoon or after any prolonged period of sitting. Second, consider using compression stockings. These garments provide consistent, gentle pressure that acts like an external squeeze on your legs, preventing fluid from leaking into the tissues and gently pushing blood and fluid back up. It's important to wear the knee-high type with a mild to moderate compression level, usually around 15 to 20 millimeters of mercury. The key to success is putting them on right in the morning when your legs have the least swelling. If you are unsure which level to choose, please talk to your physician for a recommendation. They should feel snug, never painful. Third, practice gentle movement and walking. Being still is the biggest enemy of swelling because it allows fluid to settle. Movement activates your muscle pump. When your calf muscles contract, they physically squeeze the veins, acting like a second heart to pump blood and fluid upward. If you are sitting, you can perform ankle pumps by simply pointing your toes toward your nose and then pointing them down, repeating 10 to 15 times every hour. If you can safely walk, a slow, gentle 10-minute stroll after a meal is excellent. Always move slowly and wear proper supportive shoes to prevent any falls. Fourth, you must be rigorous about checking your sodium intake. Reducing salt is non-negotiable for anyone dealing with fluid retention. Make it a practice to read food labels carefully and aim to keep your total sodium intake for the day between 1,500 and 2,000 milligrams. The biggest offenders are processed foods, canned soups, frozen dinners, and restaurant meals. Substitute salt with wonderful herbs and spices like garlic powder, onion powder, and paprika for delicious flavor. Finally, commit to adequate hydration. This might sound backward when you feel full of water, but drinking plain water signals to your kidneys that they can safely release fluid instead of conserving it. Drink water in small amounts throughout the day. Aim for 6 to 8 glasses, but check with your doctor first, especially if you have been told you have fluid restrictions. Keep a glass or a bottle near you at all times as a simple visual cue. You're doing great. We've covered solutions, but knowing when swelling signals a serious issue is vital for your safety. Next, we discuss when to call for immediate help. While most mild, symmetrical swelling is simply a part of the aging process that can be managed at home, there are certain signs that demand immediate medical attention. Your safety is always the priority. Please call your doctor immediately if you notice any of the following. If the swelling is sudden or rapid in its onset, worsening dramatically over a day, or if it affects only one leg. This is a major red flag that could signal a deep vein thrombosis, which is a blood clot in a deep vein. This is an emergency because the clot could move. If the swelling is accompanied by chest pain or shortness of breath, this combination is critical. It suggests that the fluid is backing up into your lungs, or that your heart condition may have rapidly worsened. In this situation, please do not wait. Call emergency services or go to the nearest hospital. If the swollen area is red, warm, or tender to the touch, if the skin feels hot, painful, or you see red streaks, this could be a sign of a skin infection called cellulitis. Infections can escalate quickly, especially in seniors, and require immediate treatment. If the swelling occurs with a fever, any swelling paired with a fever suggests a body-wide infection or a serious inflammatory problem. If the swelling is rock hard and does not pit when you press into it. If it feels firm and resistant, it may be a more advanced condition like lymphedema, which needs professional diagnosis and management. Finally, if you notice a sudden increase in swelling. After starting a new medication, it means the medication needs adjustment, and that must be overseen by your physician. Always trust your gut feeling. If something about the swelling feels new, different, or concerning, make the call to your healthcare provider. You've gathered all the key information today. In our final section, we'll quickly review the most important foods and habits to solidify your action plan. We have covered so much today: the signs of trouble, the basic causes, the powerful foods, and the necessary safety measures. Let's quickly summarize the most important points into a simple 3-part plan for you to use every single day. Your 3 most powerful foods are bananas for potassium to combat salt, cucumbers as your daily natural diuretic, and beets to relax your blood vessels and improve flow. Your 3 most effective habits are to elevate your legs above your heart 3 to 4 times a day, to move gently every hour to activate your muscle pump, and to seriously cut the salt by avoiding processed foods. And the essential safety rule is to remember the red flags. If the swelling is sudden, affects only one leg, or is combined with chest pain, shortness of breath, fever, or noticeable pain, please seek emergency care right away. Taking control of your health truly just requires a little bit of consistency. Start small with adding one food and one new habit today, and build on that success every single day. I hope this information provides you with the knowledge and the calm confidence you need to manage your swelling safely and effectively. Comment your worst swelling day.